Hello people, how are you? In this video, we want to look at the treatment management of schizophrenia. Basically, schizophrenia is psychosis where there is delusion, hallucination, etc. Basically, first thing you have to do in these people is take a detailed history and rule out. First, you rule out the other causes of psychosis. It could be some organic disorder like some drugs they are taking, or there could be some problem in the brain, temporal lobe, epilepsy, delirium because of alcohol, etc. If they have dementia because of age, etc. Huntington's disease, if they have, first rule out these. And other functional psychosis like puerperal psychosis, after childbirth, if that lady is behaving like that. Or if there is some maniac episode or depression or delusional disorder, okay, or this schizoaffective disorder where there is mood, that is depression or mania and schizophrenia symptoms. So you have to rule out many of these conditions, okay, and then once you have decided that it is not other psychosis or organic disease, then you can treat, okay. How will you treat? With antipsychotics, okay. How do these antipsychotics work? They are going to block dopamine receptors, okay. Overactivity, blame it on dopamine, and now you give a dopamine blocking agent, dopamine receptor blockers. Which are those? Chlorpromazine, which is the phenothiazine, haloperidol, olanzapine. If nothing works, clozapine you can give, okay. Apart from all this antipsychotics, you can give these people psychological treatment, family support, social treatment like social rehabilitation, sheltered employment, okay. So this is what they are telling as the overall treatment. Now let's get into the actual drugs here, right? Look at the drugs here. Phenothiazine, example chlorpromazine. Then haloperidol, which is a butyrophenol. Then you can talk about clozapine, that is a dibenzodiazepine. Then olanzapine, which is a thienobenzodiazepine. Wow. I would like to remember these names. Chlorpromazine, haloperidol, olanzapine, quetiapine also we have heard, right? And clozapine only if everything doesn't work, because clozapine has side effect, okay, of agranulocytosis, okay. Now coming to the side effects of antipsychotics, you should know what are the side effects of antipsychotics. So basically, these can cause extrapyramidal side effects like acute dystonic reactions, akathisia, Parkinsonism. It can lead to Parkinsonism because you are blocking dopamine. What will happen? Parkinsonism. See, this is something like this, okay. If dopamine is less, right? If dopamine is less, then it will lead to Parkinsonism. For this Parkinsonism guy, what they will give? They can give levodopa as a treatment. Now what will happen? Dopamine will become more. If dopamine becomes more, this guy can become, he can show schizophrenic symptoms. So did you understand? Or did it become too much? So basically, one of the cause of, one of the differential diagnosis in schizophrenia is a drug. Are they taking levodopa, methyl-dopa? Okay, that is very important to know, because you're giving excess dopamine to that person and maybe that is why he's behaving like that. See, this is very important to understand. Side effect of prescribed drug could be hallucinations, delusions, etc. Right? Because of dopamine being excess, that guy may be this behaving like this, okay? So you should understand what will happen if you give dopamine receptor blockers. That guy can land up in Parkinsonism. Okay, then there can be prolongation of the QT interval. Okay, that's what they are saying here. Some cardiac effect, ventricular tachycardia, torsades, D points, and sudden death because of these antipsychotics. Okay, now let us look at this table here, which is talking about the side effects of antipsychotic drugs. So here they are talking about same thing: akathisia, motor restlessness; akathisia, dystonia, dyskinesia, Parkinsonism. Very important. These are all those effects due to dopamine blockade. Because of cholinergic blockade, they can have dry mouth, blurred vision because of mydriasis, is it? Constipation, urine retention. Basically, you are trying to, this is like you're blocking the parasympathetic, right? So all these effects will be there. They can have hypersensitivity. Obviously, all drugs you will write side effect as hypersensitivity. But main thing you have to remember here is for clozapine, guys, they're talking about very good agranulocytosis. You have to stop the drug, okay, in case that happens. So this is all about the treatment of schizophrenia. So we have looked at the management of schizophrenia. Investigations, you have to rule out the other differential diagnosis, treat with drugs, psychological treatment, social treatment, etc. Okay, bye-bye.